Welcome to our discussion on the challenging realities of nurses' work environments, their mental health, and the pressing issue of suicide among nurses. We know that nurses face long shifts and emotional turmoil that extend into their personal lives, right? Which can lead to anxiety, depression, and even suicidal thoughts.
Absolutely. The evidence is clear. Nurses, particularly in critical care, are exposed to intense workloads, irregular hours, and sometimes even workplace violence. It's a combination that really takes a toll on mental health.
Right. And the data shows some stark numbers too. For instance, research found that nurses are up about 18% more likely to die by suicide compared to the general population, and especially female nurses carry double that risk. That statistic really drives home the severity of the issue.
Yeah, that's a shocking statistic, and it really underscores the urgent need to address these work environments. It's not just about the numbers, it's about the real toll on people's lives.
Exactly. The stressors are both physical and emotional. Nurses are not only dealing with long hours, heavy workloads, and critical decision-making, but also the constant exposure to human suffering and, even interpersonal conflicts at work, which only heightens the problem.
And don't forget the issue of workplace violence. The article emphasizes that nurses frequently report discrimination, verbal and physical abuse, and even sexual harassment while on duty. That's a huge barrier to feeling safe and supported.
Right? And when you couple that with the stigma attached to discussing mental health, it creates an environment where nurses often feel isolated. They're less likely to seek help, even when they really need it, which is particularly dangerous.
Exactly. The stigma acts like a double-edged sword. It prevents open conversations and makes it even more challenging for nurses to access the help they deserve.
Yeah, and the article suggests some solid strategies around reducing that stigma, like training clinicians on how to talk about mental health effectively, and even having personal testimonies from those with lived experience. This approach could really change the workplace culture.
I agree, but I have to wonder, isn't it a bit simplistic to think that just training on conversations will reverse deep-seated stigma? It seems like we might need more systemic changes.
Well, you're right. It's not a silver bullet. The recommendations do emphasize a combination of changes. For instance, they suggest creating healthier work environments overall by improving staffing levels, reducing administrative burdens with better technology, and reinforcing safety protocols.
That's a good point. Improving the overall conditions can directly impact stress levels and consequently mental health. It's almost like you need to fix the engine rather than just clean the dashboard.
Exactly. It's like addressing multiple gears in a complex machine. The article also touches on the idea of an equity lens, which means recognizing that not all nurses face the same challenges. Structural inequities can shape how stress and burnout manifest for different groups.
For sure, the call for equity is crucial. It's important for organizations to appreciate that the experiences of nurses in one department or demographic can be very different from another. Tailoring interventions to these nuances is key.
Right. And another major recommendation was prioritizing nurse well-being at an organizational level. In a survey, only 50% of nurses felt their organization truly valued their health and safety. That's a concerning number.
Yeah, it really is. When frontline workers feel undervalued, it inevitably affects not only their personal well-being, but also the quality of patient care. Have you seen how psychological safety is increasingly recognized as just as important as physical safety?
Absolutely. Psychological safety is now being championed by bodies like the National Academy of Medicine. They argue that thriving work environments can lower the incidence of burnout and moral distress, which in turn may help reduce suicide risks. It's almost like investing in a culture of care for the caregivers.
That's a solid insight. But, what about the stressors that come from logistical nightmares, like inadequate staffing or resource shortages? Those seem to be recurring issues as well.
Yes, and those stressors are heavy hitters. In environments where nurses feel they can't provide the level of care they know is needed because of staff shortages or insufficient supplies, the emotional toll is immense. It's like being put in a situation where you know what the ideal is, but you constantly
Right.
fall short because of systemic issues.
And these stresses, in turn, contribute to long-term mental health issues like anxiety, depression, and the risk of PDTS. The article points out that even during the COVID-19 pandemic, a significant portion of nurses reported these symptoms.
Yes, 1/3 of the nurses in some studies displayed significant psychological symptoms during the pandemic. That's a huge red flag about what prolonged high-stress work environments can do over time.
It really brings up the need for immediate support systems. The article mentions increasing access to mental health care as crucial. This means tailored mental health support programs, employee assistance programs, and even new initiatives like Therapy Aid Coalition and Operation Happy Nurse.
Exactly. The call is clear. We need to improve access to care. Organizations are urged to develop mental health support services that are not only available, but also truly accessible, removing barriers so nurses feel
Yep.
comfortable reaching out.
And it's not just about having a service, it's about ensuring that these services are effectively communicated and normalized. When a nurse has a tough day or week, knowing that help is just a call or a message away can really make a difference.
Absolutely. On top of that, the article stresses that workplace safety must extend beyond physical measures and include protections from verbal and even sexual harassment. Ensuring a safe work environment is fundamental for both physical and psychological well-being.
Right? And if the nurses don't feel safe, then all the other improvements might fall flat. It's like building a house on a shaky foundation.
Precisely. And while there are suggestions for zero-tolerance policies, for workplace violence, and comprehensive training programs, this should also tie into promoting a culture of accountability and support at every level of the organization.
True. One aspect that I find particularly interesting is the balance between individual resilience and systemic support. It seems like the article leans more on the systemic side, changing the culture, the policies, and the work environment, rather than just telling nurses to manage their stress better on their own.
Yeah, it really challenges the notion that mental health struggles are solely personal issues. Instead, it's showing that these difficulties are often the byproduct of the system nurses operate in, a system that needs to change.
And I appreciate that perspective. It's refreshing to see that the responsibility isn't just on the individual nurse, but on the organizations to create an environment of support, equality, and safety.
Definitely. And one of the strongest calls to action is, let's get to work. It's a rallying cry for nurses, leaders, and all stakeholders in healthcare to implement these changes. It's an invitation for everyone to contribute to building a healthier workforce.
It's a powerful sentiment. And when you think about it, improving nurse well-being is not just beneficial for the nurses themselves. It directly influences patient care and overall health outcomes. A psychologically safe work environment can lead to better patient safety outcomes too.
Exactly, it's all interconnected. Improving one element of the health system, like nurse well-being, can create a ripple effect throughout the entire care delivery process. And when we talk about regulation, using tools like the AACN Healthy Work Environment Assessment Tool can help organizations benchmark and improve their practices.
Yeah, those assessment tools can be really enlightening because they offer a tangible way of understanding where improvements are needed and then tracking progress over time.
Absolutely. And it reinforces the message that change is not just theoretical. There's data-backed evidence supporting these changes, and organizations that invest in their staff see improvements not only in health outcomes, but also in workplace morale and retention.
That's a very compelling argument because it highlights the win-win scenario. Improving nurses' work conditions benefits everyone. But I do wonder how feasible some recommendations are in resource-strapped settings, like rural hospitals.
You've got a point there. While the strategies are solid, the implementation in under-resourced environments can be challenging. It might require policy changes at higher levels, or creative solutions like tele-support systems. But the underlying principle remains. Every nurse deserves an environment that supports their physical and emotional well-being.
Right? And maybe that's where collaboration between organizations, government bodies, and even private stakeholders becomes key. Pooling resources or sharing best practices could help bridge those gaps.
Exactly. Collaboration is essential. The article is a call not just to individual hospitals, but to the entire healthcare system to prioritize nurse well-being, and in doing so, safeguard the mental health of those who are the backbone of patient care.
It really is a collective responsibility, and it's high time we translate these recommendations into action. Recognizing the impact of the work environment on mental health is just the first yet critical step forward.
Absolutely. To wrap things up, the discussion makes it clear that recognizing and acting on the mental health challenges nurses face is vital. By reducing stigma, prioritizing well-being, managing occupational stressors, ensuring safety, and fostering equity, we can create a healthier work environment that ultimately supports both nurses and patients alike.
Well said. It's a charged conversation that bridges personal well-being with systemic accountability. We really hope that our discussion encourages leaders to step up and make the necessary changes.
Definitely. Thanks for engaging in this nuanced discussion. It's conversations like these that pave the way for real change in healthcare.
Absolutely. Thanks for the deep dive. Let's keep pushing for safe, supportive environments for our nurses.